1 in every 5 people alive right now has a fungal infection, nails, skin, or both. That's more than 1.5 billion people. And here's the part that genuinely should stop you. Roughly half of everyone who treats nail fungus with standard pharmacy products gets it back within 2 years. Not because the treatment failed, because they treated the wrong thing entirely. A yellow crumbling nail isn't the disease. It's the last visible signal of a process that's been building inside the body for months, sometimes years, before it finally shows up somewhere you can actually see it. Subscribe and hit like if you want health information explained clearly and without the usual runaround. The goal here on Dr. Waterling is 200,000 subscribers, and every single one of you moves that number forward. Checklists and extra posts go out on the Telegram channel. The QR code is on screen right now. Scan it before you forget. Fungi live inside every human body. That is not an exaggeration. It's just straightforward biology. They're in your gut, on your skin, in your lungs, on your mucous membranes. Billions of fungal cells right now inside you. And the overwhelming majority of people who carry those cells never develop an infection. So the question almost nobody asks, but that changes everything once you actually ask it, is this. Why does one person get a fungal infection while the person standing right next to them in the same locker room, wearing the same kind of shoes, eating the same lunch, doesn't? The answer to that question is the entire point of this video. Science has a name for the fungal part of your internal ecosystem, the mycobiome. You've probably heard a lot about the microbiome, the bacterial world inside your gut. There are documentaries about it, best-selling books, a whole industry of probiotic supplements built around it. But fungi live right alongside those bacteria in the same gut, and almost nobody talks about them. In a healthy body, those fungi earn their place. They assist with digestion, they help train your immune system, and yes, your immune cells actually practice on fungal cells, and they take part in vitamin synthesis. As long as their numbers stay balanced, you never notice them. But fungi have a particular quality. Give them even a small opening and they don't stay quiet. They expand immediately, aggressively, and without stopping. Here's where it gets specific. The most clinically relevant fungal organism inside you is called Candida. It's a genus of yeast, a type of fungal cell that lives in the gut, the mouth, on the skin, and in the urogenital tract. In a normal, balanced state, the bacterial population around it keeps it in check. But when that balance breaks, Candida does something remarkable and genuinely alarming. It changes shape. It transforms from a round, passive yeast cell into a form that grows long filaments called hyphae. Think of hyphae like the roots of a plant, except these roots grow through the lining of your intestinal wall. They force tiny gaps between the cells of the gut lining, and through those gaps, toxins, undigested food particles, and fungal cells themselves enter the bloodstream and travel through the entire body. That process weakens the barrier that's supposed to protect you from external infections as well, including dermatophytes, which are a separate category of fungi that arrive from outside through contact with contaminated surfaces. Locker room floors, shared footwear, a manicure tool that wasn't properly sterilized. So what you end up with is a double assault. External fungi attack the nail. Internal balance is already compromised, so the immune response is weak. The cream you put on the nail has no idea any of this is happening. You apply it to the surface, and deep inside the body, the mechanism that keeps creating an ideal environment for every kind of fungus just keeps running. This is documented repeatedly in clinical settings. A patient sees fungus on one nail, buys an antifungal cream, uses it faithfully for 2 or 3 months, the nail clears up, and 8 or 9 months later, it's back, yellow and thick and stubborn, exactly where it started. Sometimes someone gets a prescription for oral antifungal tablets. They take them for 6 months. The liver and stomach complain, the nail grows back clean. Less than a year later, same nail, same problem. This pattern shows up in medical records constantly, and it isn't bad luck. It's a predictable outcome when you address the signal without ever addressing the cause. Let's go through exactly what tips the balance and gives Candida the signal to start growing. The first and most powerful trigger is sugar. Candida's primary fuel is glucose. Research has shown that in a high glucose environment, Candida colonies grow several times faster than under normal conditions. Every serving of sugar is effectively a direct supply drop for billions of fungal cells inside you. And there's a trap embedded in this fact that catches almost everyone. When Candida overgrows, it begins influencing the nervous system. It produces a toxin called acetaldehyde, the same compound that forms when your body breaks down alcohol, and it acts on the brain. According to one actively studied hypothesis, one of the effects of acetaldehyde is that it amplifies cravings for sweets. You think you want a cookie. What's actually happening is that the fungal colony is sending a signal through your chemistry to keep you feeding it. This isn't dramatic language, this is biochemistry. Practical implication: breakfast with no sugar, none at all, is worth discussing with your doctor as a starting point. Sweet oatmeal, flavored yogurt, juice, jam, all of those provide glucose to a Candida population that woke up hungry after a night of fasting. A breakfast built around protein and healthy fat, eggs, vegetables, a small amount of quality oil, starves that population right from the first meal of the day. A hungry Candida colony weakens. The second factor is antibiotics. A broad-spectrum antibiotic course can wipe out more than half of the gut's bacterial population in severe cases. It's essentially indiscriminate. It kills harmful bacteria and helpful bacteria alike. Candida, however, is resistant to most antibiotics. It survives. And when its bacterial competitors are gone, it moves into that space within days. Research shows that even a few days into an antibiotic course, the Candida population in the gut can multiply by hundreds of times. This doesn't mean antibiotics should be avoided when they're medically necessary. Of course they shouldn't. It means that after a course of antibiotics, the internal environment needs active attention, and that conversation is worth having with your doctor. The third factor is chronic stress. When you're under sustained stress, your adrenal glands produce cortisol. That's the body's emergency hormone, built to prepare you to fight or run. But cortisol has a side effect that almost never comes up in conversation. It suppresses the production of secretory immunoglobulin A. Those are antibodies, proteins that work as a first line of defense on the surfaces of mucous membranes, including the gut lining. Fewer of those antibodies means a weaker barrier between the gut and the bloodstream. Candida responds to that immediately. The fourth factor is refined food. White flour, added sugar, processed oils, packaged convenience food. None of it contains meaningful fiber. Fiber is the sole food source for your beneficial gut bacteria. Without it, those bacteria starve slowly. Not quickly like during an antibiotic course, but over months and years. The protective bacterial population gradually thins out, and the space it used to occupy becomes available. There's a useful way to picture this. Imagine a parking lot where every space is taken. A new driver circling the lot can't find anywhere to park. That's what a healthy gut bacterial population does to Candida. It occupies all the available space, and there's nowhere for the fungus to expand. This mechanism is called colonization resistance. Take away the cars, and the spaces fill instantly. When several of these factors combine, and in people over 50, they combine more often than not, gastroenterologists recognize a pattern called increased intestinal permeability. That's the technical term for what happens when those hyphal filaments force open enough gaps in the gut wall that the bloodstream is being continuously exposed to material that shouldn't be there. The immune system becomes chronically overloaded, and protective capacity drops across the entire body, including at the skin and nails. That's why people with a compromised gut barrier keep getting fungal infections even after medically successful treatment. A note on oral antifungal tablets, because they come up in every conversation about this topic. Systemic antifungals, meaning antifungal drugs taken as pills, are genuinely powerful. They kill the fungus effectively, but they also eliminate the beneficial fungal components of the mycobiome, and they place a significant load on the liver, the very organ already struggling to neutralize the toxins Candida produces. If a doctor has prescribed oral antifungals, take them. In acute cases, they're necessary, but without changing the internal environment afterward, the statistical likelihood of recurrence stays high. The treatment works, and the conditions that allowed the infection to develop in the first place remain completely unchanged. The skin itself plays a role here that most people never consider. The skin isn't just a covering, it's a functioning excretory organ. Your body pushes between 300 and 800 grams of fluid through the skin every day, depending on activity and temperature. And with that fluid, it expels toxins, metabolic waste products, and heavy metal salts. When Candida is overgrown internally, it produces toxins in large quantities, most significantly acetaldehyde and gliotoxin. Gliotoxin is particularly damaging because it directly suppresses immune cell activity, reducing the body's capacity to respond to threats. The liver handles all of this, and it does so under significant strain. It processes about 1.5 liters of blood per minute. When that filtration system becomes overwhelmed, the body shifts toward excreting toxins through the skin and nails, and the feet, which have approximately 250,000 sweat glands per foot, become a primary exit point. This is why a person can treat fungus on one nail and find it appearing on another, or clear it from the feet and see it develop in the groin or underarms. It's not a new infection each time. It's the same impaired internal system, failing to contain the same underlying condition. There's a clinical pattern worth naming here. A man in his early 60s, someone like the James who comes up in primary care notes as a textbook case. Active guy, decent diet, no obvious risk factors. He has nail fungus on 5 toes and has tried 2 different prescription treatments over 3 years. Both worked temporarily. The question his doctor eventually asked wasn't which antifungal next, but what's happening systemically that keeps resetting this? The answer, when they looked carefully, was a combination of a high sugar diet, low fiber intake, and cortisol levels elevated by chronic work stress. Address those and the next treatment course held. Here's what actually changes the internal environment. There are 9 specific elements worth building into your daily habits, all of them worth discussing with a healthcare provider before you start. The first is eliminating sugar from breakfast. Already covered, but it's the single highest leverage dietary adjustment for this specific issue. The second is garlic. Ordinary garlic from any grocery store. Each clove contains a compound called allicin. Allicin doesn't exist in an intact clove. It forms the moment you crush or cut the garlic as a defense response of the plant. In laboratory studies, allicin has shown a direct effect on Candida. It disrupts the fungal cell membrane and the cell loses structural integrity and dies. Critically, allicin is significantly gentler on beneficial lactobacteria. There's an important timing element here. Allicin concentration peaks approximately 10 minutes after the garlic is crushed, and heat destroys it almost immediately. Cooked garlic is delicious. For this purpose, it's largely useless. Crush 1 or 2 cloves, wait 10 minutes, and eat them, with a small amount of olive oil or on a piece of bread to reduce stomach irritation. Once a day, before lunch or dinner, not on an empty stomach. The third element is unrefined coconut oil, cold pressed. It contains caprylic acid, which is a medium-chain fatty acid. Where allicin disrupts the fungal cell membrane from the outside, caprylic acid penetrates inside the cell and disrupts its energy metabolism, the process by which the cell produces what it needs to reproduce. 1 tablespoon in the morning before eating. It can go into oatmeal or a smoothie, but it must be unrefined. The refining process removes most of the caprylic acid. The fourth element is fermented cabbage, not the vinegar pickled variety sold in most supermarkets, but genuine lacto-fermented sauerkraut made with salt and its own juice. 1 tablespoon of well-fermented homemade sauerkraut can contain several billion live lactobacilli, a count comparable to many pharmaceutical probiotic products. Those bacteria, once in the gut, do exactly what's needed. They occupy space, they produce acidic byproducts that are hostile to Candida, and they restore colonization resistance. 3 to 4 tablespoons a day alongside any meal. The fifth element is pumpkin seeds. 100 grams contain almost 8 milligrams of zinc, more than beef. And in pumpkin seeds, the zinc is bound to amino acids in a form that makes it more bioavailable, meaning the body absorbs it more efficiently than from most other sources. A handful, about 30 grams per day, raw and unsalted, thoroughly chewed. Why zinc? Every category of immune cell requires zinc to function. Neutrophils, the first responder immune cells that surround and neutralize fungal cells, need zinc to produce the enzymes that make them lethal to fungi. The thymus, the organ behind the breastbone where T lymphocytes mature, requires zinc for that process. Research consistently shows that zinc deficiency is associated with significantly higher rates of fungal infection. The sixth element is milk thistle. This plant has been used medicinally for over 2,000 years, and its active compound, silymarin, is one of the better studied hepatoprotective substances, meaning it protects liver cells. Silymarin integrates into the membrane of liver cells and strengthens it, reducing the ability of toxins to damage those cells. It also stimulates protein synthesis inside liver cells, which drives repair. The liver is one of the very few organs capable of meaningful regeneration, and silymarin supports that process. Ground milk thistle seed, available in pharmacies as a powder or meal. 1 teaspoon in a glass of warm water 20 minutes before eating, twice a day, morning and evening. A minimum 6-week course because hepatocyte regeneration is not a fast process. Anyone with an existing liver condition or taking regular medications should talk to their doctor before starting. The seventh element is lemon, the paradox that trips people up. Lemon juice is acidic in your mouth, but inside the body it functions as an alkalinizing agent. Lemon acid is a weak organic acid that burns completely during metabolism, and what remains at the end of that process is alkaline minerals: potassium, magnesium, calcium. These shift the body's tissue pH toward alkaline. Why does that matter for fungi? Candida thrives in acidic tissue. In a low pH environment, it grows rapidly and forms those hyphae, the filaments that push through tissue walls. In an alkaline environment, it loses the ability to form hyphae and reverts to its passive, round, non-invasive yeast form. 1 glass of warm, not hot, warm water with the juice of half a lemon 15 minutes before breakfast through a straw. The straw isn't optional. Lemon acid in repeated direct contact with tooth enamel softens it over time. Through a straw, the juice bypasses the teeth entirely. The eighth element is apple cider vinegar, and it works both externally and internally. Externally, a foot soak using a basin of warm water and 1 cup of raw, unpasteurized apple cider vinegar, the kind with visible sediment at the bottom, which contains a colony of acetic acid bacteria that creates a surface environment hostile to fungal growth. 15 to 20 minutes, 2 to 3 times a week. After the soak, don't rinse the feet. Pat them dry and let them air dry. The acidic environment needs to stay on the skin. Internally, 1 tablespoon of apple cider vinegar in a glass of warm water once a day before lunch. Acetic acid stimulates the production of hydrochloric acid in the stomach, and adequate stomach acid is the first barrier that prevents fungi from food reaching the intestines in viable form. A significant proportion of people over 50 show measurably reduced stomach acid production. This is a documented physiological change that comes with age. The ninth element is turmeric. Its primary active compound, curcumin, has a dual mechanism relevant here. It inhibits an enzyme that Candida uses to build its cell wall, and it reduces tissue inflammation, which matters because when large numbers of fungal cells die during treatment, the die-off triggers an inflammatory response in the surrounding tissue. Half a teaspoon of ground turmeric per day, always with a pinch of black pepper. Piperine, the compound responsible for pepper's heat, increases curcumin absorption by approximately 20 times. This is confirmed in clinical research. Without black pepper, curcumin is poorly absorbed and passes through the gut largely unused. Add it to food, to warm milk, to vegetable dishes. Now for topical treatment, because external treatment isn't useless, it's just insufficient on its own. When the internal environment is being corrected, topical treatment shifts from a temporary cosmetic fix to an effective and targeted tool. Tea tree oil has the strongest evidence base of any natural substance studied for fungal infections. Clinical research has shown that high concentration tea tree oil is comparable in effectiveness to standard pharmaceutical antifungal preparations. Its active component is terpinin 4-ol, which penetrates the nail plate and disrupts the fungal cell wall on contact. It must be 100% pure oil, no carrier oils, no additives. Check the label carefully. Application. After a shower in the evening, when the nail is softened and pores are open, place 1 to 2 drops directly onto the affected nail. Use a cotton swab to spread it across the entire surface and especially along the edges. Don't rinse. Put on clean cotton socks and go to sleep. The oil works through the night. Standard 5% iodine solution has fungicidal activity, meaning it doesn't just slow growth, it kills the fungus. The iodine molecule is very small, which allows it to penetrate deeper into the nail plate than most creams. However, iodine dries out the nail plate and surrounding skin with regular use. Use it on a rotating schedule with tea tree oil. 3 nights of tea tree oil, then 1 morning application of iodine. This gives you 2 separate mechanisms of attack without drying out the tissue. Hygiene details that matter more than most people realize. A dedicated towel for the feet, washed after every use at 60 degrees Celsius. That's 140 degrees Fahrenheit. Fungal spores survive a 40-degree wash cycle but are killed at 60. Cotton or bamboo socks only. Synthetic fabric creates a sealed, humid microenvironment inside the shoe where humidity can reach 90%. That's optimal for fungal growth. Change socks twice a day if feet perspire. Alternate footwear so no single pair is worn 2 consecutive days. UV shoe sanitizers eliminate spores within 6 to 8 hours. Before applying any topical treatment to a thickened, crumbling nail, prepare the nail surface. A nail plate that's thick and opaque won't let oil or iodine reach the infection. Once a week, use a single-use cardboard or glass nail file, not metal, which creates micro scratches where fungus anchors, to gently file down the cloudy surface until the plate is noticeably thinner. This creates access for the treatment to reach the depth where the fungus actually lives. 2 simple daily practices that support everything else. The first is an abdominal massage. Lie on your back, place your palm just below the navel, and make slow circular movements clockwise. 30 circles, light pressure. Follow with 10 slow, deep breaths where the belly rises on the inhale and falls on the exhale. 3 minutes before breakfast. This stimulates the vagus nerve, the main nerve of the parasympathetic nervous system, the system responsible for rest and recovery, improves gut motility, increases blood flow to the gut lining, and accelerates tissue regeneration. The second is a breathing exercise specifically for liver circulation. Sit straight. Place your right hand over the lower ribs on the right side. Inhale through the nose for 4 counts. Belly expands, ribs open. Hold for 2 counts. Exhale slowly through the mouth for 6 counts. Hold for 2 counts. 10 cycles, morning and evening. 3 minutes total. The liver sits directly beneath the diaphragm. Each deep breath causes the diaphragm to descend and apply gentle compression to the liver. The exhale releases it. This rhythmic movement accelerates blood flow through the hepatic vessels and stimulates bile flow. And with bile comes the toxins the liver has already processed and neutralized. Add a 15 to 20 minute walk after your main meal, not a workout. An easy stroll. After eating, blood shifts toward the digestive organs and peripheral tissues, including the feet, receive less oxygen than usual. Walking redistributes that blood flow. Candida is what's called a facultative anaerobe. It can survive in both oxygen-rich and oxygen-poor environments, but it multiplies significantly faster in low oxygen tissue. A short post-meal walk increases oxygen delivery to the feet considerably. The fungus finds that environment far less hospitable. Here's what one day of this protocol actually looks like. Wake up. A glass of warm water with half a lemon's juice through a straw. Wait 15 minutes. 1 tablespoon of unrefined coconut oil. Then the abdominal massage and the liver breathing, 6 minutes combined. Breakfast with no sugar. Eggs, vegetables, greens, a handful of pumpkin seeds. 1 teaspoon of ground milk thistle seed in warm water. Before lunch, 1 tablespoon of apple cider vinegar in warm water. Lunch itself with fermented cabbage on the side. After lunch, 1 or 2 cloves of garlic that you crushed 10 minutes earlier. A 15 to 20 minute walk. Dinner. Fish or poultry with vegetables, 2 or 3 Brazil nuts. They fully cover the daily requirement for selenium, a trace mineral that's essential for the antioxidant enzyme that protects surrounding tissue during immune attacks on the fungus, and a 2 teaspoon of milk thistle. After the evening shower, dry each toe individually, apply tea tree oil to the affected nails, do 10 cycles of the liver breathing exercise, put on clean cotton socks. That's the entire day. No expensive supplements, nothing exotic, nothing that requires a special order. The 90-day timeline. The nail plate on the hands renews itself over 3 to 4 months. On the feet, 6 to 9 months. Within 90 days, you should see at least 1/3 of a new nail growing from the base. That's your visible progress marker. Gut bacterial populations with proper nutritional support restore balance in 8 to 12 weeks. Liver cells fully regenerate in 60 to 90 days. By the end of 90 days, you'll have rebuilt the internal environment from 3 different directions simultaneously. What to expect week by week. The first week. Some people experience mild temporary symptoms, light headache, some bloating. This is a recognized transition response as Candida populations begin to decline and release toxins as they die. Drink at least 8 glasses of water per day during this period. It accelerates the clearance of those toxins. The symptoms resolve in 3 to 5 days in most cases. If they don't, or if they're severe, speak to a doctor. Weeks 2 and 3. The craving for sweets typically begins to diminish. This is the first measurable sign that the Candida population is shrinking. It can no longer modulate your appetite at full strength. Weeks 4 through 6. Skin on the feet begins to change. Itching subsides. Cracks begin to close. The nail base may start to look visibly lighter. New, healthy nail coming in. Weeks 8 through 12. The boundary between old and new nail becomes distinct. Below that line, yellow, cloudy, brittle. Above it, from the base, pink, smooth, solid. That line will move slowly toward the tip of the nail over the coming months. The core idea of this entire video is this. Fungal infection is not a disease in isolation. It's a diagnosis of your internal environment. When the gut is compromised, fungus grows. When immunity is suppressed, it takes territory. When the liver is overloaded, it toxifies the body faster than it can clear. When tissue is acidic and oxygen deprived, fungus is completely at home. The yellow nail isn't the problem, it's the message. It means something inside has broken down. And as long as that internal breakdown continues, the fungus comes back. Every time, predictably, without fail. Not because it's powerful, because the environment you're providing is ideal for it. You don't need to destroy it, you need to make it impossible for it to thrive. A healthy gut, a functional immune system, a liver operating at capacity, tissue that's alkaline and oxygenated, those 4 conditions together produce an internal environment where fungus cannot sustain a colony. Not suppressed temporarily, genuinely unable to grow. Speaking of age, after 55, a process called immunosenescence accelerates. The thymus, the organ behind the breastbone where T lymphocytes are produced, shrinks by 70 to 90% by that age and is largely replaced by fat tissue. Neutrophils become slower, macrophages recognize threats less reliably, and fungal infections become dramatically more common and more resistant to standard treatment. Everything in this video becomes more urgent after 55, not less. How old are you? It shapes how aggressively you need to approach the internal side of this. And knowing the age range of people watching helps me decide what to prioritize in future videos. Start tomorrow morning, 1 glass of warm water with lemon. That's your first step. When that becomes automatic, in about a week, add 1 more element, then another. You don't need to change everything at once. You need to start. If this gave you something worth knowing, subscribe and leave a like. That pushes this content toward more people who need it. 200,000 subscribers is where this channel is headed, and you're part of that. Scan the QR code on screen right now for the Telegram channel. That's where the checklists and follow-up posts live. Everything here is information, not a prescription. Your body is specific to you, and a conversation with your doctor will always tell you more than any video can.